Hi, welcome back to Everyday Behavior. My name is Mary Ann Shepard, and today we're talking a little bit more about discrete trial training. So in the last video, we talked about what discrete trial training is. But in this video, we're going to talk a little bit about what to teach during discrete trial training. So when you're deciding on what you should teach during discrete trial training, for schools, we definitely encourage you to look at your IEP in order to set those instructional goals and objectives. I also really encourage you to go back and watch our series where we talked about assessment and instructional goal setting for individuals, specifically individuals with intellectual disability or autism. And so when we're looking at this, you want to use evidence-based assessment strategies. I often refer to the ABLES or the VB map because those two are probably the most widely used within the ABA kind of industry, but there are a lot of other ones, including the Denver Early Start model. But there are a lot of other ones that you can utilize as far as your evidence-based or researched assessment strategies. What's great about our assessment strategies is they provide a standardized assessment with our goals ranked or our skills ranked in a hierarchy so that it's really easy to see what the child has mastered and what skills they still need to master. And it helps us to identify those goals and what objectives have the best target skills for the child. Another excellent benefit of using these standardized assessment strategies is sometimes we may overlook or may not recognize keystone skills that may be missing early in the student's repertoire that maybe we need to go back and reteach or remediate those skills so that we can teach more advanced skills. So like I said, the VB map is a criterion-based assessment tool that has a curriculum guide. It has a tracking system. It's specifically designed for children with autism or individuals who demonstrate language delays. So it's an excellent tool to utilize. It's quick, easy to administer, and really focuses on a wide range of verbal skills. The ABLES is the assessment of basic language and learning skills. So one thing I like about the ABLES, it's a little more comprehensive than your VB map. But very similarly, it's an assessment tool. It has that curriculum guide, that skill tracking, but it doesn't just look at language. It also looks at learner readiness. It looks at social skills, and it looks at a wider range of deficits that may impact not just language delays, but may also include or impact other developmental disabilities or things like intellectual disability, chromosomal disorders. So if you're looking at Down syndrome or some of those other disabilities, it really has a broader catch net. So then you want to look at what are our goals. So here's an example of a goal. This is a measurable goal. You may go back and look at our SMART goals, but when an adult asks Ava to show me letters, that's our antecedent phrase. So from our last video, what's our antecedent? Show me A, show me R, show me S. Ava will point to the correct letter. That's the behavior, is pointing to the correct letter in 80% of the opportunities across 3 consecutive days. Okay, so that's our criterion. One thing that's not pointed out in the goal is the consequence. So then you want to use the task analysis and break each skill down into smaller teachable steps and make sure and list those in sequential order. So you may start with teaching letters A through E, using discrete trial training with a full physical prompt, with a gestural prompt, and then independently. And then I think I got a little confused or distracted based on my goal versus my objectives here. But you can take that same goal and then work on expressive identification. So you could, if you're looking at your goal, you could then, if you're looking at pointing, expand from letters A through E to letters F through P, and then letters Q through Z. Once Ava can point to all of her letters, with 80% accuracy across 3 consecutive days, then you may want to work on Ava will expressively identify letters A through E when given a verbal prompt, when given a partial verbal prompt, and then independently. So what letter is this? And then once you're able to do that, You want to work on generalization. So Ava will point to letters A through E in stimuli on the wall in the classroom environment with a positional prompt. And then Ava will point to letters A through E on the wall in the classroom environment independently. So Ava, where is an A? Or point to A. So then you're looking at that generalization and pointing to letters across various environments. So you can kind of decide where you want to include that expressive identification in there, but make sure that you're also looking at generalization in your instructional goals. You can generalize to pointing at letters on the wall, to pointing at letters in the natural environment, such as when you're driving down the road and maybe you see a big W or a big A somewhere. You can also look at generalizing it to pointing to letters in books or other instructional materials. So this is kind of how you break down and determine your skills and your goals and your objectives. Just really kind of sit down. Don't make the mistake that I made here, where you're looking at muddying the goal with other goals like receptive versus expressive goals or objectives. And so just kind of make sure that your objectives align with that goal. I hope that this has provided you some things to think about. Really rely a lot on those assessment strategies. They may seem daunting at first when you first start utilizing those, but practice will help. And when you watch that series, I linked to a couple of continuing education that has more education or more opportunities to become more fluent in each of those assessment strategies. So as with all of our trainings and all of our videos, this is made possible in part through a contract with the Oklahoma State Department of Education. But I do want to thank you for continuing to watch. You can find additional materials on our website at everydaybehaviors.com. You can also like or follow us on Facebook at Everyday Behavior with Dr. Marianne. I do encourage you to hit the subscribe button below if you're watching on YouTube. But if you are following us on our podcast, I do encourage you to also like us on the podcast. That way we can continue to make these videos possible. Thank you so much, and we look forward to providing you more information soon. Thank you.